Dr. Vikki Petersen. Do you or someone you know have this issue? And it can be chest pain, shortness of breath, heart palpitations, a feeling of anxiety because of those symptoms, and perhaps you've had your heart checked, which is definitely the correct first step. But what I want to talk with you about today is what happens when you have pressure in your chest, you have heart palpitations, you have shortness of breath, and you have your heart checked and you're told you're fine. It can be extremely disrupting to have your heart race or have pain in your chest or pressure in your chest, trouble getting a breath. Of course, you instantly go to, I'm having a heart attack, regardless of your age. And you run to the ER and they do all these tests. And again, it's the right thing to do. But what do you do after that when you're told you're fine? And that's what I want to address, because I'm seeing this more and more and more. And this is a facet of what we treat here at Root Cause, which is a subclinical sliding hiatal hernia. And what is a hiatal hernia? It's interesting that I'm going to be talking about a stomach problem when you're having heart palpitations, but you'll see the connection in just a moment. So you have these symptoms of, as I said, chest pain, heart palpitations, shortness of breath, pounding in your chest. You run to the doctor, and if you're really tenacious, you don't believe the emergency room, and you go see a cardiologist and you have a stress test and you really do your due diligence. And these are the patients that I tend to see, either repetitive trips to the ER or seeing a cardiologist once or twice, ensuring every test known to man has been done, only to be told, congratulations, your heart is fine, which is great. However, it does not negate the chest pain, the shortness of breath, the heart racing, the heart palpitations, because that's real. Then you start to wonder, what's wrong with me? Am I making this up? Am I hypochondriac? You are not. Unfortunately, traditional medicine has a way of, as soon as they can't discern what's wrong, they want to sort of put it up here, saying, well, you're stressed. Are you a little anxious? Well, yes, I'm anxious because I keep thinking I'm having a heart attack. And next thing you know, you're on some dangerous psychiatric medication for anxiety, depression, panic attacks. This is not the solution, and it's really a terrible step to take because of the very dangerous side effects associated with these drugs. So what's really going on? Now again, you have to have done your due diligence and make sure your heart's correct. Meaning it's fine, not saying this is what you jump to first, but once you've done that and you're told your heart is fine, then the most common reason for these symptoms is what's called a hiatal hernia. So a hiatus is a hole. Hernia is something that's coming up through a hole incorrectly. You've heard of abdominal hernias or inguinal hernias. Abdominal hernias when the muscles of your abdomen get weakened and your intestines start to push out through that. You'll get a little bump. These are things you can kind of see visually often. But a hiatal hernia is your esophagus, so you've got your mouth, the tube connecting your mouth to your stomach. A long tube is called your esophagus. And then there's a little sphincter, it's called, which keeps things from going the wrong way, meaning food down into the stomach, not back up. Of course, if you've ever vomited, you know what it's like when it comes back up. It's pretty violent and not very pleasant. But the sphincter should keep things down in the stomach, and then the stomach turns them around, and then they go off into the small intestine, and that's how digestion takes place. Now, a hiatal hernia is the stomach is pushing up through that hole in the esophagus and the diaphragm, and it can create a lot of different symptoms. Now, to flesh this out, you'll see in the description of this video other videos I've done on hiatal hernia. Also, if you go to the website rootcausemedical.com, there's a free ebook all about hiatal hernia. But Why is it you get these heart palpitations and the chest pain when we're talking about your stomach? So here's how it goes. Your stomach is just under your rib cage on the left, and your diaphragm are two dome-like muscles that are on either side underneath the ribs. And the diaphragm allows air to come in. So you take a deep breath and the diaphragm bows down. You exhale, the diaphragm bows up. Very strong muscle. And of course, it never stops moving, hopefully, because you never stop breathing. However, imagine this diaphragm is trying to move and your stomach is in spasm, pushing up on it. So they call it the diaphragmatic excursion. Just means how much it's able to move. If the stomach is in spasm for whatever reason, then that diaphragm can't move as much. Subtly, you're not getting enough oxygen. It's not that you're not getting any, you're still breathing, but it's not enough. Your nervous system senses this. It's a very large nerve in your body called your vagus nerve. It does a lot of different things, but it's very much tied into what's your guts doing, what your heart's doing, nervous system, etc. And so your nervous system gets a little panicked because you're not getting enough air. And your heart rate can go up, and at times you can start to feel your heart. So that's your heart palpitations. Because you're not getting enough air, you can feel tension in your chest or pressure in your chest. And that's also the shortness of breath because you're not getting enough air. So this whole combination of symptoms translates into, oh my gosh, I have chest pain, my heart's racing, there's something wrong with my heart, I'm having a heart attack. And so it's very important to realize, once you've told your heart is fine functionally, that this really is a problem that can be solved very easily. And it's emanating from this poor stomach being in spasm, pushing on your diaphragm, not enough air, your nervous system kind of freaks out, your heart starts racing, and then of course, unfortunately, as soon as you get that heart racing, you get a little panic because you don't know why, which exacerbates your heart racing. So you get in a catch-22 about it. You likely know somebody who either has panic attacks or chest pain or heart palpitations to some degree. It's really, really common. Unfortunately, traditional medicine doesn't know what to do because they are a bit constrained by finding a syndrome or finding a disease. And in their defense, you're complaining about chest pain. They're doing their due diligence and saying, your heart, your lungs, they're all perfect. There's nothing wrong. And they don't know how to go beyond that because they don't look at the body as a whole. So if this is you or someone you know, please know that the solution is not at all difficult. And we see it often. We see it in all ages. It's really not an age or sex related problem. Last Friday, today's Monday when I'm making this video, last Friday I literally saw 3 different patients. The youngest was 15 with this problem, the eldest was 33. No, that's not true. The eldest was 63. There was a 33-year-old in the middle, male, female. It literally crosses all ages. So it is something that's extremely fixable. I don't want you to have to suffer with it or anyone you know, because it really ruins your life. It's ruining the life of the 15-year-old and it's ruining the life of the 63-year-old. And both of them, you know, they don't know what to do. The 15-year-old was short of breath almost constantly. The 67-year-old said, as soon as this happens, my day is ruined. I'm just freaked out, even though I'm being told my heart's fine. It doesn't matter if you're short of breath, you have chest pain, and your heart is racing. It doesn't matter that you know your heart's fine when the symptom is very stress-inducing. So if this is someone you know, as I said, or you, please reach out because this is a specialty of ours. And you can't just say, you know, put an ad in the paper, we treat hiatal hernia. Most people don't know what it is. So I have to look at all the facets of it. It can create acid reflux. It can create tension in the bowels. It can create constipation, it can, as I said, chest pain, it can create so many different things. And so, but the problem is the root cause is a hiatal hernia, and most people have no idea what that is. So you can't even call it by what it is to get people to understand that there's help. But so what I'm doing is breaking it down into its component parts and hopefully helping that way. So I hope you found this informative. Please reach out for a consultation. Give us a call at the clinic, 408-733-0400. If you live local to us or if you live in the US, anywhere, we can help, and that's what I'm here for. So I just find this is becoming kind of epidemic in this country, and too many people are suffering needlessly and putting them on drugs that are dangerous, and I don't want that for anyone. So I hope this was helpful, and I'll see you soon.